I am unbelievably excited to bring to you today's episode about orgasms. Rarely does my editor send me an email without me prompting about what she thought of the episode. And she emailed me after this was edited and said, "Oh my God, this is amazing." And when I re listened to it, I can't agree more. Dr. Rachel Rubin, who is a sexual medicine specialist and board certified urologist, talks to us today about anything and everything we want to know about orgasms. And I would like to thank those of you who've been vulnerable enough to reach out to me with your questions, because quite honestly, none of us are taught about this. We don't want to talk about it. We don't even know how to talk about it if we do want to have the conversation. And quite honestly, I only know how my body works, so I don't know what issues others may face. And so this is not a dull, overly scientific conversation, but it is based in research and medicine. And I can assure you, you will learn a ton. So please do take a listen to this incredible discussion. And a huge thank you to Dr. Rubin and all of her colleagues who are so passionate about making sure the right information gets out there about our sexual health. I guess first what strikes me is, as a woman or as a human, like men, women, AFBs, like you name it, there's no course to say this is what a great sex life can be. This is how the body can and should work. None of that. So, and I have interviewed a few sexual health experts, and one interesting statement that one made was, it seems like good is how you define it. But quite honestly, like, since I don't even know what good is, I may define it in a way that's totally subpar from what's possible. So I don't know how you would respond to that, but I would like to just help us all understand, what is an orgasm, and like, how could we define what good could look like?
I think it's such a great question. And when we look at medicine, we actually, I'm doing a project right now with a bunch of medical students, and they went to Reddit and they looked at a thread of Reddit called, I believe it was 2X chromosomes or something like that. And they just were gathering data from understanding what are the questions people are asking about orgasm, libido, those types of things. And we're publishing this, we're presenting it at a meeting soon. And one of the fascinating things was, when it comes to libido, there was a lot of mention of, oh, medications cause this, or I went to my doctor and my doctor didn't give me the time of day, but they were going to doctors about these questions, right? For libido. When it came to orgasm, the word doctor was nowhere to be found, right? So when women had problems with their orgasm or questions about orgasm, there was no mention from either the poster or the people responding of like, well, what does your doctor have to say about that? And so orgasm is not really sort of within the medical community as something, who do you go to if you have an orgasm problem? And this idea of, oh, it must all be in your head. It must all be due to your religious upbringing. It must all be due to your repressed nature or something, or not trying the right way. That's not necessarily correct. And sort of this biopsychosocial model that we think of, we forget about the biology part, right? That an orgasm is this massive, incredible a reflex, if you will, right? It's this buildup, it's this release, it's this magical dance between the parasympathetic and the sympathetic system. And there's a lot we don't know. There's a lot we don't understand about the biology behind it, but we know more than people really give us credit for, especially also on the male side as well. And I take care of all genders. But this idea of it's biology. And when you think of biology, there may be a biological solution to help you improve or see if we can change or even allow for an orgasm. But because this is the unmentionables and the private parts and the things nobody speaks of, it's just not talked about. And you can think on your own, and your listeners, you can all think, has a doctor ever asked you if you can have an orgasm? Right? I can start simply from there. I myself have been to many doctors in my time on earth, and I've never been asked the question. Doctors know what I do for a living. I am a sex doctor, and I've never been asked the question, right? Never. And so I guarantee that most of your listeners have never been asked the simple question, can you have an orgasm? Let alone, do you have questions about your orgasm? Do you have complaints about your orgasm? Do you have any problems? And so the data shows it takes a long time for a patient to bring it up with a doctor. And most of the time they get dismissed, or they get sort of ignored, or the doctor doesn't have an answer for them. And that's a big problem, because there are a lot of biological things that can affect your orgasm, not just psychosocial, though there are many of those as well.
First, how would someone know that they had an orgasm? I don't know if we start there, because, I've spoken to a few, and again, we women don't even talk to each other that much. I have a few that will share things with me. Usually it's after a couple of glasses of wine, but not that many. And, but I have heard a few different experiences that, again, because I only know my body, and it's not like there's a book out there, or maybe there is and I just haven't found it, but like, what should it feel like, and how long should it last, and how many times can it happen in a night, and all that?
So it's such fabulous questions. And again, there was a big discussion about this at the recent course that we taught, and sort of there's a famous Supreme Court justice quote about pornography of, I can't define it, but I know it when I see it, and this idea of orgasm is, well, I can't define it, but I know it when I see it, and you'll know it when you have it, which is not helpful for women. And there's a lot of sort of ideas. So there's some people who will say, oh, well, maybe you've had one, you just don't know it. We don't even trust you as a woman to know when you've had an orgasm, which is not good. And then there's different levels of orgasm, and there's different maybe types of orgasm, right? So there are women, orgasm is a fascinating thing, that there are women who orgasm, most commonly women don't orgasm from penetration. And so the problem is, because the media and pornography is, people think that that's the norm, is that people orgasm from penetration. And that's only like less than like 12% of people actually orgasm that way. But those women are loud, right? They are, yes. Those humans are loud. Why? So I have a theory. Okay, this is my theory. I have to scientifically prove this. You're hearing this first. So I treat all genders, right? There is a subset of people with penises who have what's called premature ejaculation or early ejaculation, that they orgasm faster than they want to. Okay. It's very distressing to people with penises, where they often in a minute or less, just light touch will have them orgasm, and they complain, they come to the urologist, and really there are things we can do to help them. It's not hopeless. There are things we can do to help. It's a small percentage of people with penises who have early ejaculation, right? I believe that it is the same small percentage of women with clitoris, or people with clitorises, who orgasm very easily, light touch, very light sensation, nipple stimulation, in their very sensitive areas, and their reflex just happens faster. In penises, it's a disaster. And in clitorises, it's life-changing, amazing. You're a unicorn. You are like, you brag about it because women can have multiple orgasms, right? And when I say women here, I mean anyone who identifies as women can have multiple orgasms. They don't have a refractory period. And so for someone who can orgasm easily and can orgasm in multiple ways, it's a very exciting, very wonderful thing to have. But I think biologically, they're probably pretty similar. And it's just one person's perfect situation is another person's sexual health disaster. Does that make sense?
Yes. Interesting. Now, what about, so you mentioned that there's multiple ways to stimulate. I guess any advice on how someone can practice and better understand it, or learn the different ways? Or like, what if, maybe someone, like you said, through even nipple stimulation, it's very easy. What if someone has no sensation in their nipples? Can that happen? Or, are these things of just how their body's structured? Or is it that there's something psychological, and once they get more in touch with their body, they could feel that? Tell me more about how all that works together.
The answer is yes, all of the above. And so when I see someone who has, I teach and treat and listen to people and think about humans with biology in mind, right? Anatomy in mind. I say, okay, what is the anatomy and how does it work? And how can we make it work better? Now, anatomy is fascinating because you have to understand that people don't understand basic anatomy. I show pictures of clitoris and penis all the time next to each other, and showing people that the reason most people don't orgasm from penetration is because the female phallus, the clitoris, the female erectile tissue, is not anywhere near the vagina. right? And so how on earth, right? If you're a man, and for all my male listeners, if you rub the inside of your leg, rub it for 5.5 minutes, are you going to have an orgasm? No, right? Why? Well, because Dr. Rubin, is nowhere near my penis, right? But it's really close to your penis, just really inside of your leg, hit it really hard for 5.5 minutes. Are you going to have an orgasm? Of course not, right? Because it's nowhere near your penis. So the idea that any woman can orgasm from penetration is nothing short of miraculous, in which case there is another mechanism by which it's happening, either a uterine orgasm, a cervical orgasm, or very sensitive clitoral stimulation allows that person to orgasm. And they're what I call my ninja unicorns, and they should be exalted and very happy and proud of what they can achieve, but that is not the norm. And so when I see someone with orgasm problems, I think very strategically of, is it a tissue local problem? Is it an anatomical problem? Right? Is it an education problem that they're just not trying the right way? Is it a nerve problem or spinal cord problem where your brain and your genitals are just not connecting, right? Or is it a brain problem where it's medications that have caused the delay, or it's, psychosocial issues or relationship issues, or, different things that can cause, brain issues. And the not trying the right way is actually often very common, right? Because people don't know the basic anatomy and the basic function. If a penis were completely internal, right? And some guys have a penis that is maybe very excess weight or something like that, where a penis can be buried on the inside. How does somebody like that have an orgasm? There's nothing to hold on to. There's nothing to stimulate. It's a challenge, right? And the majority of the clitoris is buried beneath the skin. And that's why vibration is so fabulously wonderful for people to have orgasm, not because their partners aren't skilled, not because their partners don't have the right moves or the right touch or the right this, it's because it's buried underneath the surface. And so that vibration will stimulate you in a way to allow for orgasm and allow for that pleasure. Does that make sense?
Yes.
And understanding the anatomy behind that is so important, because then I can look at the patient in front of me, and everyone's different. That's why I love my job, because everyone is slightly different, and figure out what are the things that we can do. Is it medications? Is it the anatomy? Is it the lack of figuring out, what to do or what device to get? And then we can come up with a plan and a team to okay, what can we do to maximize your quality of life and your pleasure? Because that is so important. It's so valued and undervalued in the world, but it's so important. And it is so fun to get to help with.
I admit, when I first started working on trying to figure out how I can take the experiences that I had with my fertility to help other women not have all these long delays for trying to find treatments and diagnosis, I had originally thought, wouldn't it be so cool to help people understand what works? The more I dove in, the more I'm like, honestly, the answer is it depends. So if you see that story where there's that 1 in a million person on Instagram who magically did that one thing, we don't know their medical history. So the answer is it depends. So I'm going to see if we can if we can find any specifics that might help, even if it's guidance, maybe questions to ask a doctor, because what I will say is the theme I do find is you need to know the basics to know what to monitor in your body, to then know how to talk to your doctor. Would you say that's a fair statement?
Totally.
Okay.
And just as you said, be the CEO for your own healthcare, and to say to yourself, my decreased orgasm or lack of orgasm or muted orgasm or a lack of orgasm matters to me, in which case it's a medical problem. As soon as you say the words, it matters to me, I am bothered by my lack of XYZ, it matters, and it should matter to your doctor. And if you go to your doctor with that complaint and your doctor's not adequately addressing, that means it's not the right doctor for you. And there are other doctors like myself and my colleagues who care so much about this and invest so much time and energy and want the field to get better. So we have more, not just it depends, but more treatment options to give you.
What should we monitor? Because I would hate for someone to go to the doctor and they ask a lot of questions, and because the person hasn't been paying attention, they don't have a way to describe and answer any of the questions for the doctor to help. So first of all, if you were to say, okay, for those of you listening, these are the things that I would want to ask you, that I'd want you to monitor. And maybe it isn't the case in orgasm, but I would assume there's some things that they should have some sort of awareness of to come prepared to meet with someone like you.
So things to monitor, like if you come to see me and you say, I have a wonderful orgasm with my device, I just can't orgasm with my partner. The question is it because you're thinking about it the wrong way and you're not able to relax and you're not able to sort of be, if a penetration is happening, it's very distracting. And so it's very normal for you to need to orgasm separately from penetration. And so that when I see patients like that, or I see a patient who said, I orgasm fine by myself or next to my partner, but I can't orgasm sort of with my partner in me, that's not necessarily a medical problem. That may be more of an educational problem of most people can't do that. And that doesn't mean you can't work towards doing that and find fun ways, but think of it as fun, extra fun things to like, how can we make sex more fun and make intimacy more fun, as opposed to I am damaged, I am broken, I can't do X, Y, and Z. Does that make sense? Like,
yes.
Some percentage of women, when they orgasm, leak fluid, are squirters. Can you learn how to be a squirter? Well, the data is unclear in that, but the answer is if you're having fun trying, keep trying, right? If you're feeling horrible about yourself because you can't do it, seems counterproductive because you may never be able to do it.
Actually, one of my questions for you was going to be about squirting, because I will just be vulnerable and say I had no idea that was a thing until I saw that Sex and the City episode with Kim Cattrall squirting, and they had a whole discussion about it. You mentioned that some can, some can't, possible to train yourself. I'm just curious if you were to give someone like any general tips on that, anything that would help someone learn how to do it, of course, without creating the anxiety if it doesn't work. But I'm curious if you had any tips.
So squirting is a fascinating thing and I just got texted by a colleague today, said I have a patient who's mortified that she's leaking every time she orgasms and her boyfriend is going to leave her. And I said, well, it sounds like, I wrote this in my text this morning. I said, it sounds like she needs a boyfriendectomy. She needs to get rid of the boyfriend, because there are entire porn sites where categories devoted to the wonders of female, ejaculation and female squirting. And so, we know that it's likely if there's a large volume that comes out when you have an orgasm, it's likely urine. There's no other resources. There is ejaculatory fluid and there's some lubrication and things that women make, but we don't have large stores of volume the way men have seminal vesicles and can produce, ejaculate, which isn't that much volume either. And so if there's a large volume that comes out when you orgasm, it is urine. It's not dangerous. It's not going to hurt anyone. It's not going to, it's no big deal. Put a towel down. If you and your partner enjoy it, keep going and enjoy it. One person's pornography fetish fantasy is just like the text I got this morning, another patient's nightmare, end of relationship, horrific kind of moment. And so again, in the same theory of one person's sexual wonder is another person's sexual nightmare. And we have to understand the patient in front of you. And so we think that it's this relaxation of the pelvic floor at orgasm that allows, and then there's this bladder contraction and your bladder squeezes because every part, right? Orgasm is a buildup of, tension and then a release of tension. And at that sort of moment of maximal release, some women will relax their bladders will squeeze, urine will come out, and it's very hard to control, because it's this moment of almost like a seizure. You're literally having a seizure when you orgasm. Your brain can't sort of process anything. And so this sort of a reflex takes over. And so can you learn to relax to the level and the degree to allow that to happen? There are some tutorials online, which I won't suggest or recommend, that think that you can, right? And so the right device, I've had patients find a device and they email me right away and said, oh my God, I'm having orgasms that I've never had before due to this device. And it's pleasurable for them. So I recommend they keep, doing it and adding it to their toolbox.
Interesting. And by the way, it is so funny what you said about one person's, amazing thing could be another person's horrifying experience. And it just goes to kind of a lot of the things we discuss, like with the squirting in Sex and the City, they were like, it's the coolest thing ever. And I have always been fascinated by it. And then you tell me about the text and I'm like, really? But, I was trained by Sex and the City saying it's amazing. And just like with pornography, telling in our minds that penetration is how most people orgasm, when in fact, that is not it. So it really is interesting how if you're not fully aware of how something is supposed to work and you're not trained on it, whatever is out there in the public becomes your reality. So
right?
I
And
appreciate your sharing all this.
And understanding that your partner had just as crappy of sex education as you had. So this idea that your partner is supposed to be able to know all of your buttons and all of your body and how it works when you don't always know yourself is crazy, right? Like that you're going to find this magical unicorn of a partner that just gets it and knows exactly where to go, because most people find it difficult to talk about sex, even with the person that they are having sex with, to say, ooh, a little to the left or harder or softer, or, ooh, it would feel really good if. A, most people don't feel comfortable saying that. B, most people don't even know what instructions that they would give. And the partners, you think your partner has any clue? No, they just got the same crappy sex education in middle school that you got. So it becomes important to say, well, where are we learning this education? Is it all pornography? Because that's like learning, it's just all fake, right? So it's learning in a totally the wrong sort of way to do things. So it's really the education piece that becomes really important, and getting good evidence-based sort of people out there giving good advice. And we don't have all the answers, right? If you think your doctors have all the answers, like, of course we don't. That's what makes medicine fun, is that we're continuously asking questions and learning new things.
Okay, interesting. One person had said, when I have an orgasm, I get a headache. Mm-hmm. So can you talk to us a bit about what might be happening there? And I presume there's potentially several different causes of it, but maybe you can talk a little bit about that.
It's actually really important that you see a physician if you're getting very bad headaches. Oftentimes I find that hormones can play a big role, especially when you're in the menopause phase of your life, that sometimes with the right hormones, those can go away. But if you get very severe headaches, you do want to see likely a neurologist to just make sure you don't have something very severe going on. No aneurysms, no AV malformations, no tumors, things that you just want to make sure that at this point, when you're orgasming, it's this very big buildup of tension. Your blood pressure goes up, your heart rate goes up, and almost like a stress test, right? So if you have those people on a treadmill and they get chest pain, we're worried about them having a heart attack. And so if you're at this point of maximal stress of your body and you're getting a very severe headache, you just want to make sure that it's not something scary and dangerous. And so you want to take that very seriously. So I do think it's likely nothing. It's likely sort of a hormonal imbalance or something not scary, but you definitely want to make sure the scary things get ruled out.
Talk to us about the importance of getting in the mood.
So getting in the mood, I think foreplay should be totally taken out of our vernacular. Like, we should not use the word foreplay because it doesn't make any sense. Like, it should all be sex. Right? We're having sex, because the idea of we had sex usually means man penetrated woman and orgasmed inside of her, and that is sex. And anything else is not successful sex, right? Anything else is not, like, we didn't have sex, we did other things, we did foreplay, we just heavy petted, but female orgasm, if it's valued equally as the male orgasm, if we're talking in a heterosexual situation, it should be equal. In fact, women can have multiple orgasms. So the ratio should be many orgasms on the female side to one orgasm on the male side. But what we find when looking at the data is there's a huge orgasm gap. For every orgasm a man has, a heterosexual woman has 66% the number of orgasms. And so there is I believe we can fix the pay gap if we can fix the orgasm gap, because women do not value their pleasure and their orgasm the same way men do. And so when a woman has sex with someone, right, say it's heterosexual, penis and vagina, man ejaculates, I had sex. Whether she orgasmed or not, she had sex. Right? If a man didn't orgasm, is he going to say, I had sex and I did this thing? It's looked at as, oh, it was a failure, right? It was a failed mission. I didn't succeed. And so we have to change the way we look at sex, because if we value ourselves as women, we deserve equality in the bedroom as, our male counterparts. And if we're going to demand equality, then we at least have to demand orgasm equality. And so that takes that empowerment of saying, my orgasm is important here. My pleasure is important. And if you can't orgasm, and that's not to say that orgasm is the only way to have good sex. If it gives you pleasure, if it gives you intimacy, if you're enjoying yourself, it's good sex. I think getting in the mood is going to be different for each gender and each person individually. And so you have to advocate for yourself of what gets you in the mood. And so really taking the time of, like, maybe it's a bubble bath, maybe it's reading something sexy, maybe it's watching something that gets you in the mood, maybe it's a massage, maybe it's a device or a vibrator or something like that. That should be equally as valued as the 5.5 minutes it takes for your partner to penetrate and have an orgasm.
And I'm assuming you've heard of Dipsy, and I don't know if you've also heard of Rosie. Rosie's newer.
I just hung out with the creator of Rosie at the conference. I love her. She's a good friend.
You're kidding. I'm going to have her on the podcast.
She's great.
I'm really, really excited.
Good. I'm glad you connected. She's wonderful.
Yeah. And Dipsy is amazing. I mean, I'll admit, I used it. I met the founder at this Founders Friday event that they had in Manhattan, where all the founders of companies would meet up and talk and connect. And she told her story and also the challenges of being able to get on social media, because she kept getting blocked for being porn. And actually, Lindsay with Rosie also shared the exact same story. And I'm noticing that more and more is becoming available. But I tell you, I'm like, Facebook, I get you got an algorithm. Come on, get with the times. But anyways, ladies, those are great tools. So you got to check them out. So the G-spot, I've seen there is one, there isn't one. Where is the G-spot? What is the G-spot? Tell us.
I love the question. So the G-spot is this idea, and I met Beverly Whipple, who was the first person to describe the G-spot, is the idea that some women enjoy stimulation of what we call the anterior vaginal wall, or the top of the vagina. So if you stick your finger in a vagina and make sort of a come hither motion, it is that top side of the vagina that gives some people pleasure. Now, if you take that tissue and you chop it up and look it under a microscope, there's not much there, in the sense of there's no one spot, there's no one magic organ, there's no one button to push that will give unlimited pleasure. But if you look at that tissue and you start staining it for nerves and for something called prostate-specific antigen, it starts to light up. So it turns out that it is likely, and this is something that is not fully agreed upon by all humans in the world, but it is the embryologic equivalent of the female prostate, right? So not female prostate, it's prostate tissue. Now, the prostate is a very hormone sensitive tissue. Men who have high testosterones, so the prostate grows and shrinks based on sort of how much hormones are around. And so women don't have a lot of testosterone around. We have about 10 times less testosterone than our male counterparts. So it doesn't form into like a full organ the same way it does in men, but it's still the embryologic tissue equivalent, looks the same under the microscope, has lots of nerve endings. And if you've ever met a man who enjoys anal penetration, which many men do, why? Because the prostate is filled with all these nerve endings. And when you stimulate the prostate, it's pleasurable. And so for many women, and I believe there's probably a hormone sensitivity where some women run high on testosterone and some women run low on testosterone, and different things will cause an elevation or a decrease, that there are some women who love their anterior vaginal wall stimulated to the point where they have maybe a G-spot related orgasm, or they're getting at the underside of the clitoris in a way that gives them pleasure and enjoyment. And so the moral of the story is, if you like it, do more of it. If you don't like it, you're not broken. And if you want to know if it's something that you like, have fun and add tools to your toolbox to get yourself to have fun in different ways. Because you don't go to the same restaurant every time you go out to eat. You don't go on the same vacations every time you go on vacation, right? Why do we have sex the same way every time? Why don't we think outside the box and add tools to make it more fun, more enjoyable? It's kind of this weird thing of, if you're not having sex in a standard way, that you did when you were 19, you're somehow a failure and you're not doing it right.
So since we're talking about the anatomy, I wonder if it's helpful to also talk a little bit more about the clitoris, because my understanding is there's only the part that we see, but there's so much more going on there. And we know there's a lot of nerve endings. I think it's the most number of nerve endings in that one spot than anywhere else on your body, if I think I remember correctly. But nonetheless, I'd love for you to talk to us about information that we may not know, but should, about the clitoris itself.
The clitoris is a fascinating situation, because what you see is just kind of the tip of the iceberg. We just see the little head of the clitoris, and in some cases we don't even see that. There's a proportion of women, like 25%, who you can't even see that, and it's all buried underneath. But the clitoris is a big, huge organ that goes all the way down to your butt bones. Okay, so it's made up of erectile tissue, of muscle that it just engorges and gets erect, it arouses. When it arouses, blood fills with it, and it gets bigger. And it has these little legs that go all the way down to your butt bones on either side, almost looks like a wishbone, if you will. And we don't teach the anatomy very well to doctors. We don't teach, even our textbooks, most of them don't have the full anatomy of the clitoris, whereas there's very detailed anatomy of the penis. And so there's a lot we don't know about the different things that can go wrong and the pathologies that exist. And so our research actually looks at the number of people with what's called clitoral adhesions, where the hood of the clitoris gets stuck to the head of the clitoris, and how many women have problems with their orgasm or pleasure if it's stuck together. When men have their foreskin stuck to the head of their penis, it's very painful. They have pain with erections. They go run to the doctor and get treatment for. But no one even looks at clitorises on routine exams. So how are they going to know if that's a problem or if there's an issue? And so we've been doing a lot of research on that specific issue. So it's just fascinating that you have this whole organ, and it's a large organ, and yet science is just completely wide open. And we're trying to do more work and do some research. I just actually got off the call with an amazing group of medical students who are helping me with a research project as we speak. And so I'm hopeful for the future, but we still have a long way to go.
A couple of interesting things I heard about orgasm. One, I won't lie, it was with Ms. Gwyneth Paltrow. It was like her Netflix series or whatever. And there was someone explaining like how to have like a really long orgasm and how to get into the mood. And one of the things she was talking about, for example, is like rocking the hips very slowly in the beginning. I've actually tried that. I found it definitely works. I'm just curious, like, about some of the folks that are providing these tips and what you think about like the hip rocking, or if there's other things that we may not think that would help. 'Cause that's just a small thing. And I found it made a huge impact. But other things like that we may not think of that we can just do without necessarily having to go to a doctor, and can try as something we wouldn't have thought to try.
Yeah. I mean, I think, again, this idea that if you're starting from the point of I should be orgasming with penetration, and that is should be alone what gives me sexual pleasure, there's so many things to try. There's so many things to do, right? And so the little button that you see itself is only the tip of the iceberg. And so activating that entire clitoris complex and also the pelvic floor that surrounds it plays a role too. Because remember, when orgasm is a buildup of tension and a release to give you pleasure, if your muscles are capable of contracting and releasing fully, then you may have more pleasure than someone if you're starting up here, right? If you have tight pelvic floor muscles, or you're, have stress and anxiety and everything's tight, there's not as much room to go up and release if you're never relaxed. So we think there's a large, there are these brilliant magician humans called pelvic floor physical therapists, and they can evaluate those muscles to really understand, are your muscles too tight? Do you need to learn how? It's not that Kegel's the opposite of what you want to do. Kegel strengthens, tightens. Sometimes people have muscles that are too tight. And so learning how to relax those muscles. And if you can learn how to relax those muscles during a sexual encounter, so things like happy baby or rocking your hips back and forth to allow for that pure relaxation so that you can get the buildup and the release, that certainly may provide more pleasure.
Got it.
It's fun to try.
Yeah, no, absolutely. And for those who don't do yoga, happy baby is a yoga pose. So you can Google it so you can see the position. It is a fun position to do. You definitely do feel like a happy baby, or at least I do. I do giggle every time. I'm like, yep, this is like a happy baby. And then, by the way, one thing too, when you mentioned pelvis, I recently saw, and it's funny when you put something out into the universe, all the information comes to you. So just this week, there was a Twitter post about a woman who had had some sort of hip surgery, and the way the surgery was done,
saw that post.
Okay, you saw, I think you might have even posted it. I don't even remember now where it came from, but tell us about that. Like, is there a precaution that women should have around? I mean, I can't even believe that we'd have to, like, I don't know, do we meet with the doctor and say, hey, by the way, in this surgery, can you make sure not to do X, Y, Z? Like, this is one of those where I don't even know how to handle, but can you tell us anatomically what might have happened there? And do you have any recommendations of what women can do to prevent what happened to this poor woman? And maybe you can elaborate a little bit more about what happened.
So the nerves to the clitoris, right, come from your spinal cord. So your spinal cord ends around where your rib cage is. And then each individual nerve to the lower half of your body swim in like a cable, like that there's each individual wire, going. It's called the cauda equina, which stands for horse's tail in Latin, because it looks like each strand of horse's hair, then makes the whole horse's tail. So each nerve kind of travels along the lower half of the, your back, and then it disperses to your big toe, to your sciatic nerve, and the nerve to your clitoris, the nerve to your pelvic floor, and anywhere. So they have to go from your lower back through your hips, around your hips, and up to your clitoris. And so anywhere along that pathway, you can get nerve damage, right? So if you're having any type of surgery in your pelvis, on your colon, on your uterus, on your bladder, it's not saying that everyone will have clitoris damage, but if the nerve to your clitoris becomes affected, of course, there can be consequences, right? Most of the time people do okay. Most of the time there's no nerve damage. And the problem is, because these are the unmentionables and the private parts that we don't talk about, right? Your hip surgeon is very rarely going to say in your, pros and cons of, you may have problems with your orgasm after this. But if your hip is in so much pain and you're having such bad hip pathology that you cannot walk, most people are going to say, sure, I'll take the 5% chance that I may have sexual issues because I can't even walk right now. But we don't even give women that option, because we don't even put it within the things of, what do you care about? And so for those humans who orgasm from uterine stimulation, and they're a very small percentage of people who do have these incredible uterine orgasms. I had a patient once tell me that she tasted color when she had an orgasm, and she lost that ability and she wanted it back. I said, well, I never had that ability, and that sounds amazing. Let's work hard to see if we can get it back, right? So if you remove that person's uterus for whatever reason, and some people have to have that kind of a procedure, it may affect their uterine orgasm. And so I want to know before I operate on someone and say, hey, listen, we have to do this surgery because of cancer, because of fibroids, because of bleeding, for reasons, but it could affect your orgasm if that's the orgasm that you like. And when you wake up from surgery and you have that complication, it becomes, oh, Dr. Rubin, this stinks. This is terrible. I'm very unhappy with this, but I did get warned by my surgeon that this was a possibility. And the problem is, we're not warning people because no one talks about sex.
Oh, I'm like horrified here. And then what about precautions? Because you had alluded to, someone may try too hard and then it becomes stressful and no fun. And it just made me think, we may all want a certain ideal. And I would love to know what precautions we should watch out for. And I don't even want to give examples because I don't want to prompt too much, because there's probably things that you would share that I wouldn't even think to ask. So yeah, tell us about the precautions people should take on this journey of having the best orgasm ever.
I think if people look at it from a place of succeeding, and this is the extra stuff of like, how do we make this even more fun? And I always say I love sexual medicine because it should be fun. And if you are not having fun, if it is not giving you pleasure or with yourself, or pleasure, intimacy with yourself, and it's not furthering healthy relationships, healthy activities for you, and that may be different from your partner, then it becomes not the right thing for you and your partner, or just you yourself. And so figuring out what that is and figuring out what that is for you, I think the key is seeing it as fun and pleasure. And if it's bringing you fun and pleasure, then it's probably okay. Although I will say there are things that some people find fun and pleasurable that are actually not healthy or safe or the right thing to do for another human. And so you really do want to speak to a provider or speak to your partner about what the right thing is for you and your partner. But that's what I would say is, too often we're really hard on ourselves of like, I'm a broken because I can't orgasm from penetration, instead of, okay, I can't orgasm from penetration, but if I have this device, I have this pleasurable, amazing time with my partner. Who cares who's causing it to happen? It's happening, and you have pleasure, your partner has pleasure, everyone has a good time. That should be seen as success, as opposed to I'm broken because my partner can't give me the orgasm. And so a lot of work I do is mindset work, is how do we change your mindset a little bit, and realizing that you are incredible, you're amazing. And how do we then have even more fun and more relaxation and more enjoyment? And that's when working with like a sex therapist becomes so beneficial, because a lot of the work is just realizing that it's all good stuff and you deserve pleasure and intimacy and good orgasms.
That is such an incredible way to look at it. And may I ask, when you shared the example or you stated that there are certain things that you may not want to do. Is it something that's helpful to share, or is it more of just, if I don't feel good about whatever's happening, I should talk to a doctor?
I think again, you need to feel safe in your relationship, and you need to feel valued in your relationship, and your pleasure is as equally important as your partner's pleasure. So if your partner wants to do something that you are not comfortable with, or you don't feel safe about, or that is bothersome to you, then you do need to seek help about how to communicate about it, how to find a happy medium. I'm never going to get every couple to have the same fetishes and to have the same likes and have to the same I'll give you an example. All right, let me give you an example. So I have a 70-something-year-old female patient, and her husband is in his 70s, and my patient too. And she came to see me and she said, my libido is okay on the treatments you're giving me. I have great orgasms with my devices, but my husband wants oral sex and I just don't want to give him oral sex. I'm in my 70s. I've got arthritis. I'm just not interested. And so then I said to her, well, I hear you, right? You shouldn't have to give your partner oral sex. You've done, your wifely duties over many years. I said, but it's okay that he wants oral sex. It feels good for him. He likes it. So can we compromise? They make amazing technological devices that can make him feel like he's getting oral sex. So can we buy a sleeve or a fun device that you can help him with, or he can use on his own, that you give, that you can talk about it to say, okay, he gets the feelings of oral sex, and you're supporting him in doing that and saying, it's not weird that you want this, but I don't want to do this. And we compromise. And she was thrilled. She went, to go give him permission to go get a device like that. And now they could talk about it in a way that wasn't weird. It wasn't like, you're bad for wanting this and I'm bad for not wanting to give it to you. And it was like a very happy story that they could now communicate about it. And they used their doctor as a way to sort of make that conversation okay to have.
That story says a lot about a lot of things at any age. And I think it's such a great example that really paints the picture for how we should all look at intercourse. So thank you for that. Now, earlier on, you had mentioned a couple of conditions. I don't know if there's anything specific as far as like symptoms or anything like that would also have someone go to a doctor, especially if it's something they wouldn't think of. I don't recall the names of those conditions, but you did seem to mention that there were a few out there, and I didn't know if we should raise awareness.
There are all sorts of conditions that can affect the orgasm or the clitoris. If it can go wrong with a penis, it can go wrong with the clitoris. And we see things that are called post-orgasmic illness syndrome, where you get a headache or you get brain fog or exhaustion, or you feel a lack of pleasure with orgasm and things aren't connecting. There are muted orgasms. There are painful orgasms. There are irritated orgasms. There are all sorts of things that can happen. And all of them, if they bother you, are a medical condition and deserve treatment for it. That doesn't mean all doctors are capable of listening and hearing and knowing what to do about it. So you can always go to iswish.org, which is ISSWSH, which stands for the International Society for the Study of Women's Sexual Health, or ISWISH. And there's a find a provider on there. And there are there's more than a handful of providers who are very open to helping with this. It doesn't mean they'll have all the answers, but they're at least won't laugh you out of their offices like unfortunately many doctors will.
How do you find the expert? And I actually have a find a doctor page, because I'm finding for each of these different questions, there's a whole subset of doctors, but we also need to know the right ones to go to. And so it's been great through my podcast guests to better understand who these experts are that are kind of hidden away. So I will make sure that I'll post that as well, so people have access to that. So thank you. So anything else that we should talk about that I may not have thought to ask, but you think is important for people to be aware of?
I think also just looking yourselves and looking at your own body part, like your vulva, your clitoris, it's not all internal. And so getting that mirror out and looking and saying, what does my clitoris look like? What does my vulva look like? Does it hurt anywhere? And so it's not just this mysterious private part to you. As doctors, they often hide under a sheet, and we're like mechanics, right? We're hiding under the sheet. You don't know what we're looking at. And that's a problem. I think that does a big disservice to humans. And we don't give them, everyone in my office gets a mirror, and I say, let me give you a tour of your vulva. And I go step by step and just teach. And whether you're a Harvard lawyer or a congresswoman, or, we're in DC, we've got a lot of high powered people, is nobody knows this stuff. And nobody's gotten the basic education of what your vulva looks like and is supposed to look like, and what happens as hormones change and your body changes. And so I had a 70-year-old woman who emailed me after the visit, and she said, "Oh my God, Dr. Rubin, you showed me my clitoris for the very first time, and I feel so empowered. I feel so good. That was an amazing visit." And so there is no age with which you can't learn new things, or learn new tricks, or learn how to have more fun, more pleasure. And that's what makes this field so much fun to be a part of.
Wow, that is really cool. I love that you give everyone a mirror. Like, wouldn't it be great if like every OBGYN did that as well? Like, come on.
So that's my dream, is to sort of change that physical exam to make the patient a part of it. And it's a perfect place for education. And you're in that moment, and then you can take ownership of, so if something hurts, you have now the words to say, "Oh, it hurts in my clitoris, or it hurts in my pelvic floor, or it hurts in my vestibule part of my vulva, or my urethra hurts," as opposed to, "Ooh, something's going on down there and I don't know what's going on." And so empowering humans to like take ownership of their body parts, and to like make them not feel like shameful places. And too often there's so much genital shame, right? Everyone who comes in says, "Oh, I'm so sorry I didn't shave," or "I'm sorry it smells," or "I'm sorry it's bleeding." You say, do you think an ear, nose, and throat doctor is bothered by a bloody nose? Do you think like you can, that anything you're going to bring to my office today is going to offend me or bother me at all? And I think, at some point it happens where we become shameful of our bodies. And where does that start, right? Because my 4-year-old doesn't have it. It's a body part like everything else. And so we teach it somehow through culture, through society, of this like genital shame. And it's super terrible. And we have to stop that.
Yep. No, absolutely. I agree. So what is your greatest hope for women's health?
My greatest hope for women's health is that it becomes so easy to go to a doctor to see, and they just know what to do and know what to find, and that your sexual health, your quality of life is valued like any other part of your health, in the same way that it is for all genders. And so that would be my hope, that sexual health is just health, and it becomes easy to talk about, easy to find treatments, easy, affordable, evidence-based treatments to help with any problems.
Thank you. Thank you for what you're doing. And thank you so much for making time. This was a fun conversation, because I know I grew up in a very closed-minded Southern state, but I had open-minded European parents. And I'm honestly just enjoying this because of like, we're able to just talk and be open about this. And thank you. Thank you. This was a true pleasure. And that wraps up another empowering session here at the Fempower Health Podcast. Now, before you dash off, I've got a quick, exciting invitation for you. Please join our vibrant community by subscribing to our weekly newsletter, because it's really your frontline update on groundbreaking women's health research, the latest health-enhancing products, fun quizzes to boost your health IQ, and unique discoveries that you won't want to miss. All of this delivered straight to your inbox, cutting through the noise of social media algorithms. Love today's insights? Show your support by rating and reviewing our podcast. Your feedback is more than just a pat on our backs here at Fempower Health. It lights the way for others seeking guidance and community in their health journey, amplifying the voices that need to be heard. And for a deeper dive into today's topics, check out the show notes and explore our website at fempower-health.com. Our site is a treasure trove of knowledge, neatly categorized by topics of interest and life stages, ensuring you find exactly what you need to empower your health journey. And your voice matters to us deeply. Whether you have a question, a story to share, or feedback on our episodes, reach out directly at info@fempower-health.com. Drop us a message on social media or hit reply on any newsletter. Your insights inspire our conversations. And a quick note, the knowledge we share is here to embolden you in discussions with your healthcare provider. It's not medical advice. Always consult with your doctor for health decisions. And remember, the diverse perspectives of our guests reflect their individual journeys, and it's not an endorsement by Fempower Health. Here's to empowering your health journey one episode at a time, and I'll see you on the next Fempower Health Podcast episode.